everyone, and welcome to our program, Focus on Seniors Medicare Basics, which is co sponsored by the Blount County Office on Aging and the Blount County Public Library. I am Melinda, and I'm a reference librarian here at the Blount County Public Library in Maryville, Tennessee, and I'm so pleased that you have joined us today. As many of you know, in the past, we have held our Focus on Senior programs within the building, but out of an abundance of caution, we are still continuing to hold it online through the miracle of Zoom. So for future programs in the 2021-2022 series, please check back with us for updates on how and when we will be holding our programming. In the meantime, I'm so glad to say that we continue to have a wonderful partner in Joani Shaver, who is the director of the Blount County Office on Aging. She has lots of important things to tell us about today, so I am going to turn off my camera here in a moment and turn the program over to her. Thank you so much, Joani. We appreciate you being here today.
Melinda, it's my pleasure to be here to share information. I know that Medicare is really a confusing system to navigate. So we all need to pull together as a team and conquer it. The Medicare has been in existence since it was signed into law by LBJ, and it provides just critical health care to older people. It's primarily for those 65 and older. However, younger people under 65 that have been disabled for 24 months are eligible for Medicare. So some of the people you come across may be on Medicare, but they're deemed disabled. Also, end-stage renal disease, no matter what age, they are also eligible for Medicare. Original Medicare covers 80% of the cost of what they approve. Original Medicare approves almost any basic health care, basic surgeries, all sorts of different services that you may receive through a healthcare provider. But keep in mind that 80% is what they cover. So the 20% is either going to be made up by you out of your savings account, or you're going to buy other coverage that will cover that 20%. The best source of information on Medicare is through Medicare.gov. That is the CMS website, the Center for Medicare Services. That's their website, and it's constantly updated. The Medicare and You Handbook, if you are on Medicare or you're going on to Medicare, you probably have a Medicare and You Handbook for 2022. All these page references on the slides are related to that handbook for 2022, not 2021. So the updates, the costs of each plan, the comparisons between one plan to another, those are all available through Medicare.gov. And you can ask questions and get really knowledgeable answers through that website. Don't go to any other website. There are going to be imposters. If you Google Medicare, there may be imposter websites. You don't want to do that. You want to go to Medicare.gov. What's new in 22? They've added cognitive assessments and care plans, which is really valuable for anyone who has an elderly relative that may be showing signs of impairment. They can get an assessment and have a plan developed of their care. Telehealth continues and other virtual services that really were not as prevalent before the pandemic. And Medicare continues to cover COVID and anything COVID related. So your initial enrollment in Medicare is when you first turn 65, 3 months before that month and 3 months after that month, in addition to that month, you can sign up. And the coverage begins based on when you enroll. So if you enroll a month before your birthday, it would start your birthday month. The enrollment always starts on the first of the month. If you don't sign up when you're first eligible, then hopefully you have creditable coverage through an employer that will allow you to sign up for Medicare later, but won't penalize you for not having Medicare Part B when you were first eligible. So if you are still working and you are over the age of 65 and not on Medicare, then you need a letter from your employer. The HR departments are very used to giving out those letters guaranteeing Medicare that you were insured. If you are on Social Security or have been disabled for 24 months, then you automatically get enrolled in Medicare. If you're still working and not collecting Social Security when you turn 65, then you sign up online at the Social Security website. Doesn't make sense, but you go to ssa.gov. That's where you would sign up for Medicare. And if you have any situations that are really unique, feel free to call me. That's my direct line, 977-1013, and I will try my best to answer your questions. Open enrollment happens every year between October 15th and December 7th. You can change your health coverage, your drug coverage, and it's a good time to compare costs related to one plan versus another, one network, the drug formularies in drug plans. If you want to stay with what you have after you do your homework, and I really encourage you to do your homework and compare costs. You can do that right on the Medicare website. Then if you are going to stay with what you currently have, you don't have to do anything. But if you change, then you can enroll online, or I would encourage you to at least consult with a professional after doing your homework to make sure that what you're choosing is really the best plan for you. It's very important. So Medicare has two versions. This is where everyone gets confused. Original Medicare means Part A, Part B, Part D. So A is hospital, B is doctors, D is drugs. And then any other coverage that you buy, for example, a supplement, or you could buy a dental and vision policy, that would all be under original Medicare. Medicare Advantage plans are considered Part C. They have to include by law everything in Part A and Part B of original Medicare. So you're getting exactly the same coverage in a Medicare Advantage plan as you would in original Medicare for Parts A and B. Part D is sometimes included in a Medicare Advantage plan, sometimes not. So you need to make sure you understand whether the drug coverage is in there if you're looking at a Medicare Advantage plan. And also it may include extra benefits like vision and dental that Medicare is not allowed to provide anything more than original Medicare that's listed there. And the private insurance companies are allowed, and hopefully that will change in the future, and Medicare can do the same thing. But right now, they cannot offer vision, hearing aids, health care, gym memberships, things like that. But Advantage plans do, and if that's important to you, then that's a reason to carefully look at an Advantage plan. So getting into the nuts and bolts here, Medicare Part A is hospital insurance. So it covers when you go into the hospital for care, into a skilled nursing facility, and it includes hospice and home health. Um, and the thing to always remember, and correct anyone that you think misunderstands this, but Medicare does not cover nursing homes. It doesn't cover any long-term care or custodial care. So a person who can't live alone any longer, Medicare doesn't cover that cost of going into a facility. And the co-payments, the co-insurance, the deductibles may apply for every service that's received. So it's important to budget in those costs, either with original Medicare or with an Advantage plan. One thing that is really important is if you go into the ER for something and they say they want to hold you for observation. Observation is not covered by Medicare. So just make sure if you go in and they are saying they want to admit you, that you are being admitted as a patient, an inpatient, not as in observation, because it will affect what you pay for the services. So you usually don't pay a premium for Part A because of the Medicare taxes you've paid during your work days. You have to work 40 quarters in your lifetime to be eligible and pay into the Medicare to be eligible for free Part A. Free Part A is very beneficial because this year it costs $471 to buy it. So keep that in mind. Don't quit before 40 quarters. So Part A covered services include, like I said, inpatient hospital care. There's a lot of information out there on benefit periods. So a benefit period begins the day of admission as an inpatient into the hospital or a skilled nursing facility and ends when no inpatient care is received for 60 days in a row, 2 months. You have to be out and healthy 2 months. Otherwise, you just go back in the same benefit period. And Medicare covers 80% usually of inpatient hospital care. So inpatient status is ordered by the doctor, and that's, again, what I was saying is it'll affect what you pay, and it'll also affect your qualification for skilled nursing coverage. The hospital is required to notify you if you're admitted under observation, but not until after the first day. So I would, going in, verify that you're being admitted as an inpatient. Skilled nursing care would be medically necessary care. It's covered for 20 days of a benefit period. And there is co-insurance per day for the next 21 to 100 days. All all of the costs are your responsibility after 100 days. And that applies to each 60-day benefit period. So it's not like once a year if you pay this and then you fall and you end up in a nursing facility again. That deductible and coinsurance repeats itself. Hospice is covered and is a very great benefit of Medicare. It provides family support. The patient has to be deemed terminally ill by a doctor. No longer will there be cures involved. It will be purely comfort care, and it's usually in a person's home. Medical equipment like a hospital bed would be covered, and the medical and the nursing and the social services and the aides and the homemakers, all that is covered by Medicare through hospice. So Part B is medical insurance. Excuse me. It's medically necessary services, mental health services, could be outpatient or inpatient, not inpatient, outpatient or home health, preventive or DME. In 2021, the deductible for this was $203. And then you pay 20% of the Medicare approved amount. Or if you have a supplement, that pays. Or if you have an Advantage plan that covers those costs, it would pay. Make sure that the doctors and the equipment providers that you use are enrolled in Medicare, because that will affect the coverage. So there are no out-of-pocket limits for original Medicare. Some supplement plans have out-of-pocket maximum, but most of the others, or all of the others, don't. And that's one advantage of a Medicare Advantage plan, is that it does have an annual out-of-pocket cost limit. However, it's pretty high. So what's not covered by Part A and Part B? Eye exams, massages, hearing aids are a key thing. Again, it doesn't cover any long-term care, doesn't cover services from a doctor or a healthcare provider who does not accept Medicare. Most providers accept Medicare, but it pays to ask. Moving on to Part D. D is for drugs. You have to have A and B to enroll in D. And a prescription drug option is run by private insurance companies that Medicare approves. It's for prescription drugs. And with original Medicare, you will buy a separate plan, or with an Advantage plan, it may have drug coverage included, or it may not, and you would have to buy that separately. It's important to know, I talk to many people who are going on Medicare that say, well, I don't take any drugs, so I don't need a drug plan. And I always tell them that you'll be penalized for every month that you don't have a drug plan. So it's worth it to just get an inexpensive plan. And also, you never know what tomorrow's going to bring. So it's important to have coverage in case you do have a heart attack or some diagnosis that you didn't expect. You have the coverage to pay for the drugs. There are two ways to get coverage. One is through a drug plan, standalone, and then one is through an Advantage plan. You have to live in the service plan of a Part D drug plan. You can't ask your sister in North Carolina what plan she has and use that because it won't be valid here. So you have to look in our area what's available and choose from the plans that we have. And the cost is going to depend on a lot of different things, but especially whether the drug that you are on is in the formulary of the plan you're looking at and what tier it falls in. And I always urge people to really review your drug coverage every fall during open enrollment. If you've been a doctor has added a drug to your prescription list, or if you're no longer taking something that was expensive or you had to shop around for coverage, then your options would be opened up and it might be really worth it to look at different plans. So you can do that on Medicare.gov. They have a plan comparison for drug plans. It's a really easy way to look and see it, and they come up based on the price, what you'd pay for the entire year for that plan. So the the prices for Part D are based on the plan that you're choosing, and it's going to depend on whether they cover the deductible, because of course there's a drug deductible every year too. This last year, I think it was $450. Some of the plans cover that deductible, but you're paying a monthly fee for that. What the co-payments are, and the drug plans are actually the most complicated part of Medicare, in my opinion, because everything is a moving target. The drug formularies have tiers. So if you're on a generic drug, that's probably a good thing. But if you're on something, say like Eliquis, it's important to know what tier that drug is in when you're looking at a plan, because that's going to determine how much you're paying each month. The donut hole was supposed to have disappeared by now, but I think it's still alive and well. I haven't heard much about it, but I think that it's still a concern. The actual cost for your drugs is definitely going to depend on whether the pharmacy you like to use is in the network of the drug plan or not. So I would pick a drug plan that is in the network, that your favorite pharmacy is in that network. That'll be really helpful. And then there is extra help available for prescription drug costs based on income and assets. And our agency has a program that's willing to help determine whether you're eligible and help you apply. So those numbers will be coming up later. Part C is the Advantage plan. Part C, confusion. It's an all-in-one health plan. So Medicare has approved some private insurance companies to provide the benefits and services of original Medicare, Part A and B. And many of the plans now include Part D coverage. They also include extra benefits, like I was mentioning, dental, hearing aids, vision, gym memberships. Silver sneakers is an example of an extra benefit. The key thing to remember with an Advantage plan is all of them in our area use a network of providers. So if your doctor is not in that network, you may pay more or you may not be covered. So the Advantage plan you can join if you have Medicare Parts A and B. and you live in the service area of that plan. So the most common types are an HMO and a PPO, preferred provider, and a special needs plan. And there are also other varieties, but they're not available in our area. So what do I pay for a Medicare Advantage plan? Well, your original Medicare premium, you're still going to pay. So that this year was $148.50 a month. If you choose an Advantage plan that has an additional premium, then you'll pay that too. If there is a deductible in the plan you choose, you'll pay that deductible. And then what you pay will be determined also by how much you visit doctors and how much you pay for each visit. Whether the services you need are in network or not. Whether the extra benefits require extra payments, extra benefits like hearing and vision and things like that. And then the plan's yearly limit on your out-of-pocket costs will influence how much you pay over the course of a year. And whether you are enrolled in TennCare or a Medicare savings program. So when you're considering Advantage plans, think in terms of, is there a monthly premium in addition to Part B costs? Is there an annual deductible? How much am I going to pay for each visit to the doctor? What type of services do I need over the course of a year? And how often do I need them? Do my doctors that I'm patient right now, do they accept the Medicare approved amount as full payment? If they don't, then you would be paying over and above what Medicare pays. The maximum out of pocket. And then the question to ask is, are you eligible for TennCare? Because if you are, that could save you a lot of money. And we are here at the Office on Aging to help you figure that out. Important things to know. You have the right to appeal decisions of a Part C plan or original Medicare. You can check and see in advance if a service that you want or need is covered. That if you go to a doctor that's not in the network, it really is important to check and see what the cost would be and what other options you have. Know that healthcare providers can join or leave plans, Medicare Advantage plans at any time during the year. So if you start out with Dr. Smith, but in June he retires and you have to find another provider, that provider might not be available to you. You may or may not want the fitness benefits, and you definitely want to know what the limit on the out-of-pocket costs are. So one cool thing about Part C, if you switch to an Advantage plan from original Medicare, between January and March, you can, if you don't like the plan you chose, you can switch to another Advantage plan with no penalty, or you can drop that Advantage plan and go back to original Medicare and a drug plan. That wasn't the case up to a couple of years ago. So now you can do that, but you can't switch from original Medicare to a Advantage plan, or you can't join a drug plan in those 3 months unless there's some special situation. So supplements or Medigap plans are sold by private insurance companies. They pay some or all of the remaining healthcare costs for Medicare covered services and supplies, and that's italicized for a reason. Some people think that, well, Medicare denied this, but my supplement will cover it. And that's not the case. If Medicare denies, your supplement will deny it too. They're linked, they're joined at the hip. So that's important to remember. The cool thing about supplements is they're all standardized. So every supplement A includes exactly the same benefits, and it doesn't matter what company you buy it from. Same thing with a Plan G or a Plan N. They all have letters. That's what signifies a supplement or a Medigap plan. And you have to have A and B to purchase a Medigap or a supplement plan. It will cost you an additional premium. What it does is it's predictable. So you know you're paying this premium and it's going to cover X number of dollars of your additional costs if something happens to you. Keep in mind that all of these insurance plans that we're talking about today, they only cover one person. So you need to budget in what it's going to cost if there's two people in your household. Each person is going to have health care expenses for insurance. It's easy to compare costs among companies, and I really encourage you to do that because the prices for these supplement plans can vary wildly from one company to another. And there are 10 choices designated by letters, like I said. And the whole supplement the whole concept is described on pages 75 to 78. So how can I get my Medicare coverage? You can first do original Medicare, which would include parts A and B, get a prescription drug plan, Part D, and then a Medicare supplement, or you can just risk that 20% that you would not be covered for any of that 20% that Medicare doesn't cover. The thing to remember is when you first go on Medicare, you cannot be denied for any existing medical condition by a Medicare supplement plan. And if you if you don't choose it then, you go the route of an Advantage plan and you realize you really would rather be back on original Medicare with a Medicare supplement, the supplement will ask you medical questions and can either deny coverage or charge you more based on your health conditions. So it's really important to consider all your options when you first get on Medicare and choose wisely based on your needs. So the advantage of original Medicare is you can go to any healthcare provider. Your prescriptions are not going to be covered through A and B except for basically inpatient hospital like chemotherapy or infusions, something like that is covered. You don't have to identify a primary care physician, and you don't need a referral to see a specialist. Generally, deductibles and coinsurance and copayments apply in addition to that $148.50 monthly premium. The second way is a Medicare Advantage plan, Part C. It will include identical Part A and B coverages as original Medicare, and it may include prescription drug coverage. How does your Medicare work with other insurances? it's really an individual kind of scenario. So the best way to solve the and answer your questions is to talk with human resources or your union benefits coordinator at your employer. If you're on group health coverage, it has a lot of variables as to how it works with Medicare. And if you have retiree insurance, Medicare usually pays first. So, what plan would be right for you? This is the $1 million question. So, Medicare on a supplement might make sense if you want flexibility in choosing your doctors. You visit doctors frequently for maybe a chronic health condition like diabetes or heart disease. You travel extensively within the US, or you have a second home in another part of the country, because original Medicare will cover you anywhere in the US and some of those islands out there in the Pacific. Um, and you don't mind the higher premiums to get lower out of pocket costs when you need to use your insurance. It's predictable. And there are 30 different companies to choose from that have plans available here in East Tennessee. A Medicare Advantage plan might make sense if you're willing to change doctors if necessary. If you really want a insurance that you're used to from your employer, it was one plan, one premium, you did everything with one card. If you don't visit doctors very often, and when you go, you don't mind a $25 copayment or a co-insurance payment. If you want lower premiums, which is what you would have, but higher cost sharing, especially if it was a serious illness or a long-term situation. If you don't mind shopping for plans, because I really advise people to comparison shop, go on to um, Medicare.gov and use that site to compare plans and the cost for each one and the benefits. Um, if you want options for like hearing aids or um, eyeglasses, eye exams, wellness credits, that would be available through an advantage plan that Medicare is not able to provide. And the key thing is if you want an out of pocket maximum, okay, the most I have to pay this year would be $4,500. That would be a good reason to choose an advantage plan. Right now, I think there's over 14 plans to choose from in our area. Just keep in mind that they're regional. So if you're planning on moving somewhere outside of our immediate area and you're just going on Medicare, it might be wiser to just choose the original Medicare, which is available wherever you move to. So if you're not happy, again, you can switch from one advantage plan to another, or you can go back to original Medicare during that window, January 1st to March 31st. There are many special enrollment periods. They're itemized and explained on those pages in the Medicare and U-Book. And many of them have to do with moving or retiring or losing or obtaining TennCare or extra help or moving into a facility. You can switch to a 5-star rated plan also. I don't know if there are any 5-star rated plans in our area that you can switch to, so that may not be an option anyway. So You got this all down now? I hope so. I hope I've been successful. It's really a simple equation. Look at your options and buy the best insurance that you can afford, but do it after you do your homework. So you know what your needs are. You know approximately how often you see a doctor or have drug prescriptions refilled, and that's going to determine what plan is going to be the best for you. No one can pick it but you, and that's the sad thing. Is I wish I could just say, well, do this, but I can't. So right now, like I have mentioned, the premium is $148.50 for Part B. That'll go up for sure. I saw some estimates that would go to $152, but it'll be on the Medicare.gov website. Or if you don't go on the website, you'll notice it as it is deducted from your Social Security check in January. The deductible for Part B was $203 this year, and then there are deductibles for inpatient hospital too. So it's the deductibles, the co-insurances, and all that that are the most confusing things when trying to compare. I really encourage you to talk to an insurance expert, talk to a broker, somebody who sells more than just one company, and get a variety of plan costs before you take the plunge. So the biggest mistakes made are signing up either too early or too late, not understanding the difference between a supplement and an advantage plan. I think that's becoming more and more clear to people. But if you still have questions, feel free to call me and we can run through it again. Don't guess when you're picking a plan. Don't just say, well, that sounds good, or AARP sounds reputable, or I have my insurance with this company, I'll just go with them. I would not recommend that. I would do some research and find out what would be best and what would be cost effective for you. And if you are anywhere near low income, please call our office and we will determine whether you're eligible for extra help with prescription drugs. That's just becoming more and more of an issue with people. So we'd be happy to help you. And then every year in about September, you get a mailing from your current insurance company saying, here's what we're going to charge you next year, and here's what's not going to be covered, and here's what we're adding. Don't throw those out or don't stack them in the corner. Take them out and look at them to see what is changing in your coverage. So then you know, okay, well, nothing's changing that affects me, so I can just stay with what I have for Part D, or you need to look for something different. And it's based on any new prescription drugs that you've been that have been added to your regimen over the past year. So extra help is available for people with those income and resources. And we also have programs that help pay Medicare premiums, which is a really big benefit to a lot of people. So these are amounts for 2021. Hopefully the income and resources will go up next year and more people will qualify for help with prescription drugs and with Medicare savings. But we are very interested in helping anyone who's struggling at all with paying for their drugs or their premiums for Medicare. The program we have is called Savings Checkup. It's the name of our benefits enrollment center. We have helped over 1,000 people save $3.25 million by signing them up in the past since January of 2019. So in a little, like almost 3 years, we've done just about $1 million in savings a year for people. And we'd love to help you if you need the help. The number will be coming up here in a second. For prescription drugs, these two websites are really valuable. They're also apps you can put on your phone, and they compare prescription prices that GoodRx will tell you the lowest price for getting a Shingrix shot, for example. And Needy Meds will help with prescription costs, connecting people to programs that will help pay for those costs. So those are two valuable resources. SHIP is our state health insurance program. It's funded by the federal government, and it gives free local counseling to Medicare recipients. It's independent of any insurance company. Several of us in my office are volunteers with the SHIP program and receive their training. They will handle at the 800 number, they will handle problems with billing and complaints that you may have. So that's a good number to keep it handy. It's also in your Medicare and You book. So if you need to call that number for a billing issue or anything, feel free to call them. They're there for you. The difference between fraud and abuse is mainly intent. Medicare fraud and abuse waste billions of our tax money every year, not just like over 20 years. This is every year, billions of our tax dollars are going down the drain due to fraud or abuse. Example of fraud would be billing for things not provided or medically unnecessary. And abuse would be scheduling patients for multiple visits so they get that higher reimbursement from Medicare. So if you suspect that's going on, please report it. That also is in your book. So to help stop the fraud and abuse, ask questions. Look at your Medicare summary notices. Make sure no one else is using your card. Don't share your Medicare number with anyone, especially not anyone on the phone. And don't accept free services in exchange for your Medicare or your Social Security number. They're almost guaranteed to be a scam. They're trying to get your number so that they can use it or sell it. So the Senior Medicare Patrol is who works on the fraud and abuse and errors. If you have any concerns, they have a number here. It's also in your Medicare book that you can call and report or have them help you solve any issues that you have. The best sources of information, like I said, the most recent is going to be on Medicare.gov. Your book is the next best thing. And then SHIP, also our local SHIP office in Knoxville, and the Medicare number. And then our savings checkup, our benefits enrollment center will help you in determining whether you're eligible for any benefits. And AARP has a number of really good resources that I want to encourage you to look at as you're making your choices. So, like I was saying, you can call me, you can contact a broker, You can contact your current insurance agent, get updated costs for next year, and then maybe do a comparison online with Medicare.gov. There are many different ways to get the answers you need. And here's our contact information. My name again is Joani Shaver, and I'd love to talk with you on the phone and try and solve any issues or questions you have. Teresa O'Mary manages our Benefits Enrollment Center, and she would be happy to do a screening over the phone to see if you qualify for any of the federal benefits that we assist people in applying for. Thank you so much. It's been a pleasure to share this information with you, and I wish you all the best of luck in solving the issues.
Thank you so much, Joni. I really appreciate the way that you take this complicated information and make it so much more understandable for all of us. Thank you again. And if you, the viewers, have questions for her, please feel free to contact her at the numbers that she has provided or check on those other resources. And if you would like to see her presentation again, it will be available on the library's website, on Facebook, and our YouTube video for an indefinite amount of time. So you have many more options to watch it or to let someone else know who might be interested in watching it also. And of course, if here at the library we can be of help to you with general information, please feel free to contact us anytime at 865-982-0981 or visit our website at www.blountlibrary.org. Thank you so much again to Joni, and thank you, our viewers, for joining us today. And we hope that you will continue to stay healthy and safe, and we will look forward to seeing you again the next time we focus on seniors. Thank you so much. Bye-bye.